With major federal funding cuts on the horizon, New Mexico is trying to get ahead of the curve. Lawmakers just wrapped up a special session pumping tens of millions of dollars into the state's healthcare system, but officials say it is only the beginning of a long financial fight. News 13's Michaela DePauli has that story.
In response to looming federal funding cuts and changing qualification requirements for both Medicaid and SNAP, the special session pumped nearly $66 million into the state's healthcare authority, the agency that oversees those programs.
I've heard that we're the only state so far that has really taken action to prepare for these federal reductions.
The money is meant to help the HCA prepare for what's coming in the years ahead and to offset changes that have already started taking effect.
I feel like we're really well positioned, and there was a lot of support for making sure that the agency has what it needs, not only to support families, but to just get ready.
At least until the end of June 2026, the HCA will be able to maintain SNAP benefits for seniors and people with disabilities and keep insurance premiums stable, one of the issues on the federal level that's led to the government shutdown.
And then lastly, we've received some additional support to maintain SNAP benefits for individuals with a lawful immigration status, but who will be losing federal SNAP benefits.
With these immediate concerns addressed, state leaders admit that no matter how much funding is used to backfill federal cuts, it's still unclear how the state would ever be able to fully cover the costs.
The federal reconciliation bill is going to reduce federal payments to New Mexico's healthcare providers, specifically hospitals, by $8.5 billion over the next decade. So it would be hard to shore all of that up completely.
The $8.5 billion figure does not account for cuts to food security programs.
So the state can't fix or plug all of those holes, but we're really trying to prepare for and minimize those impacts for New Mexico's families.
Republican lawmakers argued the federal funding cuts don't count as an emergency, which is required to call a special session. But the HCA says it was critical to act now so the state can stay in line with federal healthcare rules and avoid getting hit with costly penalties.
If we waited until the 30-day session and we didn't get any budgetary resources or additional staff or any extra support, that we would really not meet those federal deadlines.
Michaela DePauli, KRQE, News 13.
During the upcoming 30-day session, the HCA says lawmakers are expected to take a closer look at what it will take to prevent New Mexicans from losing their health insurance.